Hello, everyone. This is Dr. Dan Cartalicchio. I want to welcome you again with my colleague and my friend, Dr. Uma Naidu, to the Destination Health podcast. Actually, it's a mini cast. We're going to be with you for the next 10 to 15 minutes. Dr. Uma is a Harvard-trained nutritional psychologist, professional chef, and author of the book, This is Your Brain on Food. Dr. Uma, welcome back.
Hey, Dr. Dan, thank you so much. And it's good to see you.
Yeah, you know what? I missed this past Friday. We were both
I
busy
know we were
and
both busy and with work and it couldn't happen, but I'm glad we could get on today.
yeah, you know what? That's okay because I look forward to our conversations once per week. I think on Friday, let's meet up again because
Okay.
we have a holiday weekend.
That's right.
And,
We do. Yeah.
and let's talk about what individuals should be doing over the holiday weekend, in lieu of, going to a barbecue and having,
Yeah.
ton of, hamburgers and hot dogs and so forth, which is going to mess up your biochemistry and your brain and so forth and so on.
Yeah.
So what are we going to talk about today? I think we're going to talk about salad and fiber. What does that got to do with brain health, Dr. Uma?
I think that's a great question, Dr. Dan, because when my patients speak to me and I tell them about eating more salads and eating more greens, they can sometimes roll their eyes. And the truth is there's actually a significant amount of evidence, not only for eating fruit and vegetables that have been studied in terms of mood and anxiety, but another factor is the fiber. You don't get fiber from animal protein or seafood, but you do get it from vegetables, from fruit, beans, nuts, seeds, legumes, and healthy whole grains.
Mm-hmm.
And salads can be the exact format to get all of those elements in. Why fiber? Because fiber actually feeds the good bugs in the gut, and they need the fiber to survive and form the good breakdown elements such as short chain fatty acids. So one of the things to think about, or the way to think about this is, how many colors can you get into your salad and how many different types of vegetables and low glycemic fruit like, blueberries or strawberries. And I think the other thing that people don't often know is that the folate in leafy greens, the vitamin C in things like red bell peppers, one of the highest levels of vitamin C, all of
Yes.
those things contribute to a nutrient dense meal.
Yes.
And all of those nutrients are good for the brain: magnesium, zinc, vitamin C, all of those. And then the colorful vegetables and fruit bring back phytonutrients. So there's an antioxidant punch there. So simple thing like, doctor saying to you, nutrition saying to you, eat a salad and eat the colors of the rainbow, and it's good for your fiber, is much more meaningful now because fiber has become really important in regulating our gut microbiome. And it has so much more significance now because a happy gut is a happy mood. We've said that before. So
Yes.
that's the balance you want.
You know what? And I love our conversations because we always say, oh, eat a healthy salad. And a patient will look at us and say, why? Or I kind of understand why.
Right.
But now what we're doing is we're taking it to the next level and we're saying, well, you know what? It is good for your gut. And if it's good for your gut, it's good for your brain and it's good for your mood, so, anxiety and depression and so forth. You and I were discussing, I read an article in 2018 where fiber, is helping decrease inflammation. From there, it's been shown to delay brain aging, helps with cognitive control, and it also helps out with sleep, which is imperative for our brain health.
Absolutely.
Also, you're talking about the phytonutrients. There's so much that phytonutrients can contribute to.
Exactly.
And we're coming up into the cold and flu season in October, November, and it helps boost the immune system. So eating your greens, eating a salad is extremely important.
Exactly. And the other thing to mention about immunity is that so much of the immunity is housed in the gut. So
Yes.
here's another reason to bring back those healthy foods. And
Right.
you're absolutely right. But, we're getting notices at the hospital already. We've got to go get our flu shot. So, it's it's that time of year.
Hmm.
And the better, the healthier ingredients you put in your salad, the better you're going to boost your immunity, the better you're going to take care of your gut.
Hmm.
And the different colors, I like to gamify it for my patients. I'll say to them, I'll challenge them, how many colors can you put in a day or
Right.
in a week? Make it different, switch it up. And here's the other thing I love to do is that, how when you buy fresh herbs, or maybe you have an herb garden,
Hmm.
or you have a farmer's market and you get, a bunch of parsley or cilantro, or whichever one it is, and you're like, how can I use it all up? If you're not making basil not making pesto that week, you have a bunch of basil. All of those are delicious in salads.
Yes.
I use them as a green in my salad. So whether
Hmm.
it's arugula and romaine, I like the to me, the darker green is better because of just the richness of the folates and the chlorophyll.
Sure.
And so I'll just put in the herbs, and it totally bumps up the flavor, and just to get that sprig of basil, a little punch from the piece of parsley. All of that really adds to it being interesting and more delicious. Because I think I was having this conversation with someone earlier. When people feel they have to give up something, and they tend to feel it's not going to be tasty. But if
Right.
you feel you can add in these 25 salad ingredients in a week, or these 35 salad ingredients in a week that you can play with, that are all healthy for you, you use it with appropriate portion control. So with the
Right.
greens, you can go, you can have a ton of greens and be okay. But with things
Yes.
like legumes and stuff, you want to use some portion control because the carbs add up, and create that balance. And then people feel they're eating something. They don't feel having to give up more food that they love.
Right. And one of the themes that we've been talking about is making it healthy and delicious so that
Yes.
you're not giving up. I had this conversation also this week with a colleague of ours, and they were saying sometimes it's very difficult because you're taking foods out, you're putting foods in.
Hmm.
But even if you do that, you can make sure it's healthy and delicious. And fiber is extremely important, as we've said, for our gut health. Okay, gut health is extremely important for overall health, especially for your brain health. Delays brain aging, decreases inflammation, cognitive control, which is
Hmm.
extremely important as we are getting older. Okay.
Absolutely. And
Eh,
this month, September, is World Alzheimer's Month.
Oh,
So
that's
this is
even
this is important. This is a very important discussion. And the way I like to think about it is fiber is your friend, because it also helps anxiety. And it helps anxiety
yes.
in the sense that it makes you feel full. So
Hmm.
when you are feeling full and you've eaten a meal that is nourishing and is satisfying, your blood
Right.
sugar and your insulin is not bouncing around the place. Compare that to when you eat a sugary donut and the sugar crash you get after that.
Right.
So it helps you to keep you on an even keel, because the fiber-rich foods break down more slowly in your body, and that
Right.
way, you're not going to have a difference in how you're feeling emotionally in relation to anxiety.
Right.
So fiber is your friend.
And it's very important because you don't want to eat that sugary donut because now your insulin's all over the place, and that'll affect your brain health in addition to,
It
right?
does. It does. It absolutely does. So, I really have to be careful about how I share my philosophies with patients, because it's well and good to have a treat once in a while, but people really need to understand that it's we're talking about a once a month kind of thing, or
Right.
a piece of something in a week. We're not talking about having the donut every day or having the box of donuts. And I think that's where it can be a bit of a slippery slope, Dr. Dan, because
Yes.
I think when you have a conversation with a patient, it's very different, or with a client or with a colleague, because you put it in context. You don't just say, sure, go out and have that ice cream you want. Yes, you can, but when we say that, and I'm sitting with someone, I qualify, I want you to have this amount, I want you to
Right.
put it away or get it at an ice cream store, so you get a small serving. In fact, I tell them to get the children's serving, because the adult serving is huge, and move on. And I think that I think that's why, for me, as I speak to more and more individuals and do more of this work, it becomes easier to say, here are the healthy things you can build in.
Right.
Because sometimes when you open the door to a treat and something sugary or something, like a donut or whatever it is, it can create the wrong impression for someone. And
Yes.
what I don't want to do is have them feel like, oh my God, I can have that donut now, and it sets up a slippery slope. So I think
It
everything in
does.
moderation. Yeah.
I think it does set up a slippery slope, and I think that's very important. And you and I are successful in our practices in helping people out, through nutritional therapy, and especially when somebody's coming in the beginning and they need to change their lifestyle, and one of our colleagues, another physician, asked me, you know, what makes it so successful? Well, we do what we're doing here. We motivate, we educate, and we inspire. But then I also say to them, listen, don't buy those donuts, especially in the beginning, or if you have them in your house, put them in the garage. And if they're in the garage, you might as well put them in the garbage can.
Exactly.
And we'll
They're close
figure
enough.
that out.
No.
And we'll figure that out
Right.
in a month or two. Let's get you back on track, and let's
Exactly.
get you eating better. Not to
Right.
say that you can't have a donut, like you said, once a month, or having a children's portion of some of your favorite ice cream, like you were saying.
Mhm.
One
Exactly.
step at a time.
One step at a time. And I have to be really super explicit about this because, remember in mental illness that when someone's struggling already with depression or anxiety or schizophrenia, sometimes they hear a message and from their doctor and they think, oh, well, my doctor said I can go eat ice cream, so it has to be very explicitly shared with
Yes.
clear instructions. And I hate to do that because, you don't want to tell people what to do all the time. But the truth is you have to give guidance, because if you just said,
Yes.
sure, go and eat that, it's really almost like a bite of a donut once in a while and move
Right.
on, so that you have that taste. The truth is it's hard for people to do that, because when you have a bite, you want the whole thing. We know
Right.
that because of how sugar impacts the brain. So,
Yes.
I've adjusted that a little bit in how I work with patients to say, look, let's, like you're saying, let's just use environmental controls. And that means through the pandemic at the beginning, we bought some unhealthy foods.
Yes.
Supermarkets were struggling to stock their shelves. People were panicking. And now it's time to let those go, because if they're at home, you're going to reach for when you have your afternoon tea or your morning coffee, you're going to reach for those,
Right.
and I want you to just not have them there. Because if they're there, it's going to be hard to say no. It's going to be hard for your brain to forget that it's there.
Right. And unfortunately, that was the first foods that everybody went to, Dr. Uma, was those,
and they're shelf stable. Yeah, they're shelf stable,
right.
ultra processed. Yeah.
All the ultra processed foods, they're palatable, they're affordable.
They're hyper palatable.
Yes, they are.
We've talked about this before, right? They tested, research and development, they tested to be so tasty that they're hyper palatable. They same thing with fast food, fries. You want the biggest size, you can't put them down.
Yeah, you want to have that
eat
because
them all.
it's good.
Exactly. So it's
right.
we know these things, and therefore environmental controls become
Right.
important. And someone gave me a great recipe the other day for crisps made with spinach. Buy the fresh spinach, roast it up in the oven, use some sort of light avocado oil, salt, pepper, and your favorite seasonings. And instead of having pretzels or salty crackers, make that, because it's a completely whole food, healthy.
Right.
And it's a great idea, and it doesn't take long. So I'm really I think, trying to use more of that right now, because it gets confusing for people.
Yes, it does. And, for us, and having the guidance and so forth is really good. We do have some questions here.
You do?
From our, is cilantro, is that amazing on salads? Would you recommend that?
So it depends if you like. So I cook different types of cuisine, but I also cook Indian food, and cilantro is one of the herbs that we use a lot of, because the spice is coriander, right? And the herb is cilantro. So I'm used to it, and I don't mind a little bit in my salad. I think it gives it a little bit of a pop. If it's not something that you love, then use parsley or use another green. I
Right.
would use the amount so that it doesn't overwhelm your salad. I'm just using it as an idea to share with people to kind of spice it up, make it different for
Right.
yourself.
Right. And so I do want to give a shout out to two of my former students, Andrea and Johanna, who are always listening to us. And they
You must be
have
a popular lecturer, Dr. Dell.
I may be, I don't know. I'm afraid to look down to see what they're writing about that. But they have the book, and they're very excited, you know,
Awesome.
about reading the book. So, Dr. Uma, okay, our time is just about up.
Yep.
Do you have anything else that you want to add to our conversation today?
I don't know. I guess I'm more thinking about what we should talk about on Friday before the holiday. So that's where my mind is at.
I think
Yeah.
what we will do is talk on Friday. We'll talk about 1 o'clock again.
Okay.
And what we should discuss is the holiday weekend.
Yeah.
And let's make sure individuals are educated and motivated and inspired to keep eating, appropriately, because a lot of barbecues, the unofficial end of summer. And so, you know, people have a tendency to go out and they eat a lot of stuff, could be bad for your brain. So let's make sure that they are ready to go. And Johanna said, I am her favorite teacher. Okay.
Ah, there you go.
All right. So, you know, well, she already got her grade, so she doesn't have to worry. And Andrea is saying, always listening, learning, and being inspired. So we must be doing a good job, Dr.
Oh, good.
Uma.
I'm happy to hear that. I'm happy to think of some ideas of, you know, just providing some ideas for the weekend for people.
Yeah, let's
You know,
do
whether
this.
it's, you know, oven baked fries or using an air fryer oven or whatever it is, we'll come up with a few good tips for people.
All right, I like it. So
Great.
I want to thank everybody for coming in and listening today. Dr. Uma, thank you very much.
Thanks, Dr.
as
Dan.
always.
Always good to talk.
Always good, and we'll see everybody on Friday. Take care now. Bye-bye.
Take care. Bye.